Hi, I'm going to talk about the ideal weight for you to have a tummy tuck. And like most things in medicine, there's no absolute answer to this question, but there are a couple of things that you can take into account when deciding might be the right time for you to have a tummy tuck. First of all is the absolute value of your BMI. Now, your BMI is your body mass index, and that's your weight in kilograms divided by your height in meters squared. And most of the studies, it's not written in stone, but most of the studies have looked at a BMI of 30, and they suggest that if your BMI is above 30, you've got a higher rate of complications than if your BMI is below 30. Now, nothing magical happens at a BMI of 30, but broadly speaking, the lower your weight, the lower your risk of complications. Now, I do sometimes operate on people who've got a BMI above 30, and it might be someone who's had massive weight loss. A BMI of 30 might not be achievable when they might have lost a lot of weight already, and it might be that they'll never get to, or don't actually want to get to, a BMI of 30. So it is possible to do surgery on patients who have got a BMI above 30, but broadly speaking, a BMI of 30 is where it is considered to be safer to do a tummy tuck in relation to the risk of complications. Now, clearly, that is an arbitrary cutoff, and nothing specific happens at that, so it's not set in stone. But around that sort of figure is where most doctors and most surgeons will make a judgment. Now, that's only one aspect, and I have to say, arguably more important than the absolute value of the BMI is whether you're happy and stable with your weight. And if you want to have weight fluctuations either way, if you want to put on or lose weight, then it's best to do that before having surgery. So it may be, maybe that you've got a BMI below 30, but you may still want to lose weight. And I'd say we'll still lose the weight before having the tummy tuck, because you want to be having surgery when your weight is stable. You don't really want to be having any sort of body contouring surgery when your weight is fluctuating, because weight fluctuations can have an unpredictable effect on the results of the surgery. So the reason that you need a tummy tuck, well, there's two reasons really. First is if you've had children, and second is if you've put on and lost weight, because both of those things do the same thing. Having children stretches the skin of your abdomen, putting on weight stretches the skin of your abdomen, and then delivering the child or losing the weight, the stretching force goes, but the skin stays stretched. It doesn't recoil sufficiently, and you're left with redundant skin that then needs to be tightened in terms of the tummy tuck. And so if you have a tummy tuck and you make the skin as tight as you possibly can, if you then go on and lose weight after the surgery, then it may be that you'll be left with some redundant skin, which could have been made tighter if you'd lost that weight first. Similarly, if you go on and put weight on after the surgery, then you could get more fullness centrally or to the sides. And so ideally, you want that weight to be stable, because it's unpredictable where the weight will come on or go off if you put on or lose weight. And so you don't really want to have an unpredictable effect following your surgery. Now, clearly, we're all operated on by life and things happen in life, but if you know that you want to have some weight fluctuations in the future and you're not at your ideal weight, then that is the most important thing. You need to be comfortable and stable with your weight, ideally with a weight below 30, but as I say, that is a BMI below 30, but that is not written in stone. And if your BMI is above 30, or even if your BMI is below 30 and you still want to have changes in the weight, get those changes in the weight done first. Try and get to a stable weight that you're comfortable with, and if it so happens that that weight is above a BMI of 30, then we can have a conversation. I'll say, well, you might be that you have an increased risk of complications, but you might say, well, I'm happy with my weight and I'm stable with my weight, and then it might be we will come to a decision and accept that increased risk of complications, given that you don't want to artificially get your weight to a certain level and then have surgery and then put on weight because you don't feel comfortable with how you look and how your body looks. So I hope that's been helpful. As I say, nothing's written in stone. It's always something that we come to a decision after a discussion with your surgeon, and hopefully we can come to a decision between us. It's not like a them and us thing. Come to a decision together, because at the end of the day, we want to get the best result for you and what is right for you. And so that is something that we're always striving to achieve. If you have any questions, you can always get in touch with us, email us. We'd really love to hear from you. I hope that's been helpful. Bye.